manage it, food safety, kind of just one big. Okay, these are the things to consider when pregnant. So I will get started. So the first thing I want to say is, food is fuel. Food, and talking about food and nutrition is really, really important. Food has power. Food can influence our mood, mental health, our energy levels, how our body digests things. It can absolutely influence our weight and how we gain weight in our pregnancy, etc. And ultimately, we want our growing babies to be healthy. We want our growing babies to be at a healthy weight and a full-term infant. And food, nutrition absolutely can play a role in that. And so when we think about pregnancy, important nutrients that are kind of highlighted are folate, which a lot of people hear about, omega-3s, iron, calcium, vitamin D, and fiber. So throughout the presentation, I'll just kind of share where we can find these nutrients and how it is quite possible to get them all in a balanced diet, as well as when we take our prenatal supplements. I also want to mention that this list of vitamins would look different if you were a vegetarian or a vegan. There would be a bit more emphasis on a few other nutrients. It wouldn't be just these basic ones. So I definitely recommend you contacting me and just kind of getting a bit more education if you are vegan or vegetarian. Okay, and you can interrupt me at any time. So the first one is folate. Folate is a nutrient that I find a lot of women of childbearing age or pregnant women or moms hear about. It is typically, I find, the motivation around taking a prenatal supplement for a lot of people, because we have been educated that folate is what will help prevent neural tube defects. So super important nutrient. It is considered, or it is a B vitamin, and there are two names for it. So folate is what is naturally found in our foods, and folic acid is the man-made or say synthetic version that has been added to certain foods and that is found in our supplements, our prenatal vitamins. They both do the same thing. Food science is pretty amazing, and they've made it so that we can have both. So folic acid, builds those new cells, like I mentioned, so really important for baby's brain, baby's nervous system, and all that kind of stuff. So when we're looking at I'm just going to move my little video thing. When we are picking a multivitamin or a prenatal vitamin, you want to make sure there's around 0.4 milligrams of folate. Some women even will start taking prenatal vitamins for the folate while they're trying to conceive, knowing that it's so important in those beginning stages of the baby's development. So even though prenatal vitamins are absolutely important and necessary, we don't want to rely solely on supplements to get the nutrients we need. We always want to encourage food and having good food sources. So when I think of folate, how I remember it, so I'm not kind of getting overwhelmed, is I think beans and greens. That's going to cover your folate. And so any type of bean you can think of, or legumes, your lentils, black beans, kidney beans, chickpeas, and anything green will have folate in it. And so if we're having a balanced diet, couple greens, maybe try to include some legumes a couple times a week, you will absolutely get the folate naturally. Now, like I mentioned, folate has been added to foods. And so if you're like, I don't like beans, greens are kind of tough. You will also be getting your folate from white flour, enriched pasta, and enriched corn. So our food system, our food science knew the importance of folate for women. And so they added it to foods that were commonly consumed. So it is likely you are getting the folate you need with your prenatal vitamin, if you eat any of those enriched foods, beans and greens. So you got it covered. So that is the first really important one. The next one is iron, that is commonly talked about. So iron is a mineral found in many foods. It's also added to some foods. Iron is what is going to help build new red blood cells and help them carry oxygen. So when we are pregnant, we will start to produce a lot more blood to support our baby. They say that it will increase by 50%. So really important that we are consuming enough iron to meet those needs of all of that new blood that we are making. So there are some symptoms that we will feel if we are not getting enough iron. And so you will likely feel very weak, tired, dizzy, maybe some shortness of breath. You might just feel sick and it's just not going away. Maybe it's different than morning sickness, having trouble concentrating, fast heartbeat, pale skin, lips, and nails. And so there are some scary risks associated to an iron deficiency, but they are completely preventable. You know, there is a risk of baby being born early, low birth weight, baby having anemia, and all of the scary stuff. But it's not meant to scare you. It's just showing you that it's completely preventable with a diet. And again, we're thinking prenatal vitamins. You want to look that it has 16 to 20 milligrams of iron in the supplement. So if you answer yes to any of these statements, you may be at a higher risk for low iron. So it can kind of go both ways. You might not have enough iron in your diet, but you could also be kind of predisposed. There are just some factors that might make you more at risk to low iron. So if there's a lot of vomiting in the morning, or because of morning sickness, 2 pregnancies close together, maybe pregnant with twins or more, not eating enough foods, skip meals, cut out foods. I had low iron before I got pregnant. I'm a teenager. I had heavy menstrual flow before pregnancy. So just wanting you guys to be aware that there are, so if you answered yes to any of these, I would highly recommend maybe talking to your doctor, midwife. You can discuss it with me. Just trying to understand kind of the full picture and if there's a risk and if there's some things we can do to help you and baby be as healthy as can be. So just wanting to give you guys a visual, since iron is so important. When we think iron, we often think protein foods. They're found pretty much in the same types of food, so not overcomplicating anything. Just think, you know, every meal I have, or even snack, have a type of protein, and then you're going to get your iron. So beef, chicken, pork, wild meat, lamb, tofu, eggs, fish, nuts and seeds, peanut butter. These are the really good sources of iron. Iron is also found in plant-based foods, a couple of vegetables, but not large amounts. So we're always kind of thinking, what is the best source of iron that we can have? So this is one we commonly hear. I'm getting my iron from my spinach. So is eating spinach a good way to get more iron? Does anybody want to guess or tell me what they think about spinach? Nobody? So I will say no. Although spinach has iron, there's truth to that. So when we have people, you know, saying, even vegetarian, vegans, they're saying, you know, I'm getting my iron from spinach. Our bodies have a really hard time using it. There are certain compounds that prevent absorption, and then there already are very low amounts. So we call spinach a non-meat iron source, or a non-heme. Again, spinach has a lot of other great vitamins and minerals in it. Remember, it has folate that we talked about before, so great vegetable to continue eating, but we don't want to consider it our source of iron, if that makes sense. It'd be a source of a bunch of other stuff. True or false? Having a hard-boiled egg with an orange will increase the iron your body uses by 4 times. Anybody?
True.
That is true. Good job. So when we are eating non-meat sources of iron, or really any source of iron, we can help the body absorb it by consuming foods high in vitamin C. And so really pairing it isn't that tricky. You're essentially thinking any type of fruit and vegetable will have high amounts of vitamin C, but specifically our non-meat sources of iron. So eggs, peanut butter, beans, lentils, nuts, sunflower seeds, our fortified cereals, breads, and pasta. We want to consume it with a variety of fruits, vegetables, and that will help our body use the iron that much more. So since iron is very important, there's a couple high iron meal and snack ideas. I don't need to go through it now. I can definitely give Ruth this information. But I find people are always interested in ideas, especially while pregnant and with young kids, thinking of new snack ideas and new meal ideas. And so you can see the very first one says cereal with strawberries or dried cranberries. And you might think, like, how is that a high source or an iron food? So the cereal would have to be fortified with iron. And then the strawberries are going to help the body absorb the cereal or the iron that's found in the cereal. So that would be that combination that we're looking for. The third one, so we've talked about folate. It would be found in your prenatal vitamin as well as foods, iron in your prenatal vitamin as well as foods. And the next one is fish and omega-3 fats. So fish has a lot of wonderful things in it. Protein, we just talked about the iron, zinc, really healthy fats. And one of the fats, or the type of fat that we're interested in fish, is called omega-3, and specifically EPA and DHA. And those are the guys that are really important for baby's brain, nerve, and eye development. And there's a ton of benefits for mom as well. So when we're thinking EPA and DHA specifically, we're thinking marine sources, things found in the water: salmon, trout, mackerel, algae, krill, all great sources of EPA and DHA. And so the recommendations are to aim for 2 servings of fish per week. And I understand that this is a hard one. This is a hard one for myself as well. You know, there can just be food aversions. There can just be a general dislike. And so I will talk about other options. You don't have to eat fish, but it is an excellent natural source. And so I wanted to mention that if you are willing to try to have, you know, a cup of fish per week, it could be an option. And so some fish have high levels of mercury. Often when we are pregnant, we become aware of, you know, okay, there's some foods that are safe and kind of unsafe foods. And so we encourage you to consume, if you're going to start to eat fish, consume these ones more often: canned light tuna, salmon, etc. I can send you guys this list. But the ones we want to limit are the big predator fish. So just think really big guys that are eating a whole bunch of other little fish, and then their mercury content is higher. So tuna, shark, swordfish, that kind of stuff we want to limit. Are there any questions? We also have a chat option. If you guys don't want to interrupt, you can ask questions on the chat, and then I'll kind of get a ding and I can look and I can answer, so that you don't have to feel like you're cutting me off. Okay, so like I mentioned, you know, what if I don't like fish? I can't eat the recommended servings. So there is another type of omega-3 that can be converted into EPA and DHA. It is in really small amounts, but it is still something, so we don't want to, you know, disregard it. So things like walnuts, flax, hemp, soy, canola oil, they have ALA, and that will be converted in small amounts to EPA and DHA. So you could, you know, buy some flaxseed and sprinkle it on everything. You know, every morning you can add it to some yogurt, smoothies, cereal, muffins. You can just kind of start adding a little bit of flax in your diet, or hemp hearts, using canola oil to cook, etc. Can kind of sneak in some omega-3s into your diet. You could also take a fish oil supplement. Definitely talk to your doctor or pharmacist about recommendations. I will note too, I looked at my prenatal vitamins, and my prenatal vitamins have EPA and DHA. So it does depend on the brand you buy. There's a lot of options out there, but if you're having certain nutrients in mind, it is possible to get them in your prenatal supplements. Another thing is you can get EPA and DHA in fortified foods. So kind of like, well, exactly like folate and iron, which have been kind of synthetically added into our food supply, so it has omega-3. And so it can be in fortified eggs, margarine, yogurt, juice, and soy beverages. We want to make a note not to take cod liver oil during pregnancy. Really, really high levels of vitamin A can be toxic for baby. Okay, so that's it with fish. The other important nutrient or mineral is calcium and vitamin D. So calcium is a very, very important mineral during pregnancy. So you have to think of it like this. I am growing a human, and it's very cool, but this human is full of bones. and teeth and muscles and nerves and a heart, and everything's being created, and calcium is needed for all of those things. And so what happens if you're not consuming enough calcium in your diet, baby will start to take it from you. It will just drain mom and take what it needs, which is great because baby will grow, but we don't want mom to start to become deficient. We want mom to also have strong bones and teeth, and not be at risk for fractures or any type of bone issues. So the recommendation is to have approximately 1,000 milligrams of calcium a day, and it can kind of look like a big number. But if we have a cup of milk a day or a cup of fortified beverage, you'll get approximately 300 milligrams. And then we're just thinking, okay, we're having a variety of foods. We're going to have cheese, yogurts, and then there's plant foods that also have calcium. So we're eating, greens, tofu, almonds, orange juice, etc. Will give you your calcium needs. So unless you are completely omitting dairy or any type of beverage, you will likely be getting your calcium needs a day. Just be mindful, sometimes it's hard to drink milk. I understand that. But if you think I'm just going to try to have a cup of milk a day or a cup of some type of beverage, it will definitely get you on the right track. Vitamin D is paired with calcium because calcium is vitamin D dependent, meaning that in order for our bodies to absorb calcium, it needs vitamin D. They literally attach, and vitamin D carries it across the membrane. And so our bodies can use calcium. We need around 600 international units of vitamin D a day. And vitamin D, I find, is the exception in regards to supplements. As a dietitian, I'm always encouraging food first, but our only source of vitamin D really in foods is through fortified foods, such as your milk, margarine, goat's milk, plant-based beverages, some orange juices. Naturally, it's only found in fatty fish and egg yolks, and in very small amounts. And so you kind of have to think of the big picture. We live somewhere where we're not getting a lot of sun. You are likely not consuming the natural sources a lot. So a supplement can definitely be an option for vitamin D. Again, look at your prenatal vitamin. You likely will have some in there. And then in regards to the fortified options that I mentioned, so you're drinking milk for your calcium, you'll also get some vitamin D in your milk. So if you have a cup of milk a day, you will get around 100 international units of vitamin D. And so depending on how much milk you drink, you could get up to 200 IUs of vitamin D. And then other fortified options like our cheese, our yogurts, or eggs, you're taking your prenatal vitamin, you should be okay. After you're done your prenatal vitamin, you can absolutely look into a vitamin D supplement to kind of carry you through. Okay, I think I said everything about that. So I just kind of wanted to summarize because that is it for the first section of specific nutrients in pregnancy. When we think pregnancy, we can kind of get overwhelmed, but really the most important is folate, iron, omega-3, calcium, and vitamin D. Now, typically, we never want people to just hyper-focus on specific nutrients because that can take the joy out of food, it can take the joy out of eating, it can make us kind of overwhelmed. And I want to remind you that if we eat in a balanced way, we eat a variety of foods, we're not omitting specific foods or food groups, you'll likely have it covered. And of course, while pregnant, super important to take your prenatal vitamin. That will also help you out. So kind of on that, I thought I would throw in, general nutrition reminder and kind of what this balanced eating looks like. And so the plate method is really cool. I really like how they have updated our food guide. So we're thinking our protein foods. Protein is what's going to keep us full. It's also the building blocks of our body. Carbohydrates, energy is what's going to give us fuel. It's going to energize us. And then these plant foods, the half our plate, is what gives us fiber, vitamins, and minerals. And so if we are eating all those kind of things, they're all working together to give us exactly what we need. And we'll get all that stuff. We'll get our iron from our protein and some plant foods. We'll get our folate from all those greens and beans, even our enriched grains, etc. So it's possible to get it through our prenatal vitamins as well as food. A couple other tidbits. When we are pregnant, we want to limit caffeine to no more than 300 milligrams a day. So that's approximately 1 to 2 cups of coffee. Caffeine levels can vary depending on what you are consuming. So for example, there is caffeine in black, green teas, cola drinks, Slurpees, your ice caps, energy drinks, chocolate. So be mindful if we're having coffee plus, treats and different things that also have caffeine in it. Of course, we want to avoid wine, beer, hard liquor, wine coolers when we are pregnant. We also want to limit drinks high in sugar. We never want to displace or fill up our tummies with things that aren't really going to give us anything. For a moment, we might enjoy the treat, and treats are totally okay. We want to make the treats worth it. We don't want to just be grazing and having them whenever. We want to make it worth it. And kind of have those balanced meals whenever we can. And so when we're thinking beverages, we want to have water, tea, maybe coffee, sparkling water, milk, etc. There are other options. I'm really into carbonated water. I find that's kind of been a big thing, and it can kind of it makes you feel like you're drinking something fuzzy, and it's flavored, so it can be a little bit better than water. This is another common question that we get a lot when pregnant. Herbs, herbal teas, what's safe while I'm pregnant or breastfeeding? And so when we think safe teas, we're talking about drinking it as a tea. We're not talking about supplements, pills, or extracts. We would consider that not safe. So echinacea, peppermint, rosehip, orange, red raspberry leaf, and rosemary are all safe. I will get this handout to you guys if you are interested. There's a lot of stuff, and it's very hard to kind of remember. And so it's nice just to have the list. That's what it is for. Ginger is safe. Again, not a ginger extract or a ginger supplement. It's always safe to have hot lemon water, hot apple juice, hot milk if you're just kind of craving something hot. And then there's a big list for, we're not considering these safe at the moment. So I don't really need to go through that. I will get you guys this resource. Artificial sweeteners. This is another common resource that we distribute. Basically, the unsafe ones are the sweet and low and the sugar twin, the cyclamate, and that would be a no. Artificial sweeteners can still be used, especially if you are someone with diabetes and we're dealing with our blood sugar levels. You still can carry on. Zevia is a popular one lately, and that one's okay to drink as well. Okay, the next little pregnancy tidbit is weight gain. So when we are pregnant, we know that our bodies are changing rapidly, and sometimes having an understanding about these changes and where the weight is going can help us feel better, maybe help us feel less anxious about our bodies kind of changing without us having much say in it. So we know that people come in all different shapes and sizes, and that is true in pregnancy. We never want to compare bumps. Bumps come in all different shapes and sizes. No two bumps are the same. So I just want to remind you guys of that. Also want to mention that gaining weight in pregnancy is super important. It is vital for your growing baby, and it's exactly what your body is supposed to be doing. And so when you're thinking weight gain, it's not just you, it's not just your thighs, it's not just your body. It's going to a whole bunch of different places. It's going to the extra blood, fluids, protein. Some women have a lot more fluid accumulation, and that can contribute to weight. Our breasts, energy stores, uterus, placenta, baby, amniotic fluids, etc. So just kind of showing you guys that weight gain is so much more than just that number on the scale. It can signify health and baby doing really, really well. Another thing with weight is the concept of eating for two, and that can actually be considered a myth. When you are in your first trimester, You actually don't need any extra calories. That first trimester, there can be a lot of food aversions. We can be throwing up and feeling yucky. And so what's most important during that first trimester is just to eat what you can, to stay hydrated, eat those nutrient dense foods, make sure you're consuming protein and those kind of things. We're pregnant and all of a sudden we need to eat all of this food, and that's not necessarily the case. In your second and third trimester, you do need a couple extra calories, but that can simply be, an extra meal, a few extra snacks. We don't have to necessarily indulge just because we are pregnant. However, I truly believe in, being an intuitive eater, trusting your appetite. If you're hungry, please eat. If you're full, learning to kind of respect that fullness feeling. And again, enjoying treats, enjoying those snack foods, but being mindful of, if I eat just the chips, will I be full, or am I still going to be hungry and kind of lingering around the fridge and pantry? So kind of pairing it with something that will actually fill you up. Okay. So I'm going to quickly go over common pregnancy symptoms because they do relate to nutrition. And there are some helpful tips with managing heartburn, nausea and vomiting, and constipation, that kind of fun stuff that happens when we are pregnant. Okay, where am I at? Okay, so a lot of people experience heartburn when they are pregnant. So heartburn is when food and stomach acid backs up into your throat. Sometimes we will feel it right when we lie down. Some people will feel it if they bend over. Some people just kind of get this sour taste in their mouth. So I want to give you guys some tips to help relieve and prevent heartburn. And so the big one is you want to eat slowly. That's the big one. So whenever you're eating, whatever you're eating, eat slowly, chew your food well. It's also recommended to eat small meals versus like 3 really big meals. It's recommended to separate your liquids from your food. That can help. And also they say drinking milk can help relieve heartburn for some. In regards to the lying down, wait a couple hours after you eat, or you can even sleep with your upper body raised higher with a pillow. And loose fitting clothing definitely helps as well. So in regards to food, it's completely connected to what we eat. So if you are really struggling with heartburn and you find certain foods are triggering, just be mindful of what you've eaten. You can also have a little journal, like, okay, I had this type of supper and these were my symptoms. You can kind of track and figure out which foods are making it worse. So greasy foods, spicy foods, acidic foods, chocolate, caffeine, pop, tend to not help the heartburn situation. And then of course, what are we left with? All the other healthy options of a balanced meal: vegetables, crackers, milk and water. There are some antacids for heartburn during pregnancy. And again, this resource is available, so I can just shoot it off to you guys, so we're not kind of getting stuck on each point. But just note that there are some not safe antacids listed on the bottom, and I don't really want to try to pronounce those, but note that the baking soda one, which I have heard of women trying, is not considered safe, as well as Pepto-Bismol is not safe to treat heartburn while pregnant. Nausea and vomiting, a lot of women experience. Unfortunately, it can happen at any point in your pregnancy. I find it is known that the biggest kind of trigger to nausea and vomiting is having an empty stomach. And so kind of not skipping meals ever, eating kind of throughout the day in small meals, sips of water. With this third pregnancy, I just, for some reason, wasn't thinking, and I would be so thirsty and I would chug water and I would throw it up every time. And I'm like, I'm so thirsty, but then I'm so nauseous. And so it was really just this disastrous combination. So small meals, sips of fluid will help you. It also helps to have some snacks beside your bed. You could potentially kind of eat some crackers, some dry cereal right before you wake up if you can, just so you're not shooting out of bed on an empty stomach and taking care of everybody else. Ginger tea can also help to relieve nausea in some women. Again, if it's smell induced, of course, avoid any stinky garbage and certain foods. You can always ask somebody to help you cooking food. If raw meat is really bothering you, I recommend buying a pre-cooked like rotisserie chicken, and just trying to find ways to not have to handle raw meat. So these are some options in regards to if there's certain things that are kind of making the nausea and vomiting worse. Some people will find it's really hard to take their prenatal vitamin, and there's some options there. So I will give you guys this handout, and you guys can contact me if you have any specific questions with nausea and vomiting. Constipation during pregnancy is another unfortunate side effect that can often happen. And so really the remedy, when you think constipation, the solution is you got to eat more fiber and drink lots of water. That pretty much is the main solution. Again, I will get this handout to you, but when we're thinking fiber, we are thinking your fruits, your vegetables with your skins, whole grains, beans, legumes, etc. That would kind of get your fiber covered. So when we're thinking balanced eating, we're wanting to eat lots of fruits and vegetables anyways. We're wanting to have whole grains because the whole grain would not have the fiber removed. And so you will get it that way. We wanted to have beans and lentils and chickpeas to get our folate and our iron. So when we're eating foods for all those other good reasons, the fiber will just kind of come naturally. It's all working together. I'm not trying to give you guys, and more foods to eat. I'm trying to show you the pattern of how if we kind of keep eating a certain way or kind of trying to include certain foods, you're going to get everything you need. You're going to get the folate, you're going to get the iron, you're going to get the fiber. It's just kind of being mindful of those whole food options. So the whole wheat, when you're looking at bread, if you're willing to try a more whole wheat bread, the tip is to look for the bread that says 3 grams of fiber per 1 slice. That's actually a good source of fiber for your bread. Vegetables, not peeling your vegetables, eating it with the skin, beans, lentils, chickpeas, etc. I want to do a quick thing on food safety. I find when we become pregnant, it kind of crosses our mind, okay, I know there are foods that I should no longer be consuming because I am pregnant. I want to be food safe. And so this is kind of the general list you guys can reference and use. So when we become pregnant, we want to avoid cold cuts, so anything found in the deli. However, you can consume like salami and all that kind of stuff if it's cooked. So just think like pizza, totally safe. You want to avoid smoked salmon, cooked and canned is fine. Uncooked hot dogs, raw fish, shellfish, undercooked meat, so like your steaks, your burgers, raw sprouts, raw or lightly cooked eggs. So make sure your eggs don't have any runny yolks. Of course, sushi, and then those unpasteurized milk, cheese, or juice. So that would include kombucha and those kind of more trendy drinks that are out there. So when we're pregnant, we become a bit more vulnerable. Our immune system is slightly compromised, and we are just at a risk for being sick with listeria. And listeria is that bacteria that is commonly found in these foods that are raw or slightly undercooked. So to kind of carry on with food safety, we of course want to make sure our foods are thoroughly cooked. We want to be defrosting foods properly. So we never want to defrost anything frozen on the counter. It will just thaw way too slowly and possibly become at room temperature, and then all that bacteria just multiplies in that room temperature zone. Just a reminder not to refreeze thaw food and eat those leftovers within 2 to 4 days. When we think storage, all you have to think is keep your cold foods cold and keep your hot foods hot. Don't let any of those foods linger at room temperature longer than 2 hours. And of course, we're all getting pretty used to cleaning. So with COVID, we're cleaning our hands, countertops, utensils. It's the same thing with food safety. We want to be washing our hands, avoiding cross-contamination, etc. Just kind of want to throw in a couple COVID-19 tidbits that were on here. Just in order to keep you and baby as healthy as possible, we're wanting to wash our hands at all times. You don't have to sanitize food packaging. You don't need to sanitize your groceries. Wash produce as per usual, just with a little water, etc. there is no evidence of being pregnant increasing the chances of catching COVID-19 or passing it on to your baby. So just the same general procedures as the public is following. And that was just, yeah, other changes to consider: virtual appointments with healthcare team, one-on-one support, etc., depending on what your needs are. Okay, so it was a lot of information. I'm hoping that